football player who was admitted with complaints of muscle paresis and tingling dysesthesia of his toes. Okay, some big words there, and ankles, after the first day of preseason practice. Now what's important is he's a football player, and he's completed a day of practice, and now he's having these complaints of trouble, muscle paresis and tingling, and things like that. So that sounds like that would be associated. He was returning to his dorm when he had a syncopal episode, so he got dizzy. And then the attending physician ordered a fluid challenge and a urinary catheter inserted. Subsequently, it was noted that his urine was dark red or cola colored. There's your big red flag. Which of the following should the adult critical care specialist suggest as the most likely cause of these clinical problems? Okay, well, you put all the pieces together. We had a football player, first day of practice, they're banging into each other, and now he's got dark red urine. Well, that's classic for this rhabdomyolysis. When the skeletal muscles get banged or damaged, crushed, they release the chemicals that are going to change the color of the urine to something dark. Okay, and that's what we're dealing with here. So if you've studied your pathology, you should have recognized that as being a classic sign of trouble. Looking at the other options, letter A says disseminated of trouble. Looking at the other options, letter A says disseminated intravascular coagulation, or DIC. Well, that's a problem with coagulation. That's not what we're having here. Also, letter D says decreased clotting factors, 2, 7, and 10. That's another coagulation problem. So both of those are kind of associated together, and neither one is relevant to what we're talking about here. Lower GI bleeding, that might occur if somebody had some cancer in their colon, or they had hemorrhoids, or something else going on in their colon. They might get GI bleeding. That's not really the situation we would expect here with a 19-year-old. So given his age, given the history of what he was doing right before he had all these problems, it makes sense that his muscles got banged up in the practice session, and that he's getting this dark-colored urine as a result. And so the correct answer is B, rhabdomyolysis.